This is the posterior abdominal wall. What we can see here medially next to the vertebral column is psoas major. Okay, you can see the psoas fascia, the white glistening fascia covering it. Okay, on the lateral aspect we can see a quadrilateral muscle here. This is quadratus lumborum. The kidney is reflected forwards. You can see in the upper plane here. This is the kidney. It is reflected forward by one of the student. With their hand you can see their gloved finger here in this corner. They are pulling the kidney forward. So the point to note here is there are three nerves running parallel to one another on the posterior surface of the kidney. It forms the relation, posterior relation of the kidney. From above downwards, these nerves are the subcostal nerve, the superiormost, okay, the iliohypogastric nerve, the middle one, and the lower one is ilioinguinal nerve. So what are these nerves? What is their area of distribution? We will see in this video. The first one, subcostal nerve. How to confirm? If you just palpate above this, there will be a bony projection, and that is 12th rib. Below that will be subcostal vein and artery. We have reflected here only the nerve. So this first one here running downwards and obliquely is called the subcostal nerve. It is a ventral rami of 12th thoracic nerve. This subcostal nerve runs forward and supplies anterior abdominal wall muscles. That is external oblique, internal oblique, and transversus abdominis. Finally, it ends by supplying rectus abdominis, a straight muscle in the anterior abdominal wall between the aponeurosis of external oblique, internal oblique, and transversus abdominis. And that is called rectus abdominis. That is the area of supply of the subcostal nerve or the 12th thoracic nerve. Moving on to the next nerve, the iliohypogastric nerve, the intermediate one, the middle one, what is pointed here is iliohypogastric nerve. It emerges below and parallel to the subcostal nerve. So after T12, what is the number? It is not T13, it is L1. If you told L1, it's a correct answer. The ventral rami of L1 forms the iliohypogastric nerve. As you can clearly see, it runs in front of this quadratus lumborum and anterior layer of thoracolumbar fascia downwards and obliquely. Then it reaches the anterior abdominal wall. It ends by supplying these muscles, the internal oblique transverse abdominis muscle. It is called iliohypogastric because it is running over the surface of the ileum and supplies the area below umbilical region, which is called as hypogastric region. So therefore it is called as iliohypogastric nerve. It supplies the skin of the lowermost part of the anterior abdominal wall just above the pubic symphysis. Also, it supplies one muscle within the rectus sheath called as pyramidalis muscle. There is a communication existent between the subcostal and iliohypogastric nerve through which it can also supply rectus abdominis muscle. So that is a distribution of iliohypogastric nerve. Last but not the least, the third nerve which is running parallel to the iliohypogastric, this lowermost nerve what you can see in this picture now is ilioinguinal nerve. This ilioinguinal nerve is also a ventral rami of first lumbar nerve from the lumbar plexus. It runs downwards and forwards in front of this quadratus lumborum. It will first supply transversus abdominis, pierces the transversus abdominis and enters the inguinal canal. It will not enter the inguinal canal through the deep inguinal ring. It will enter the inguinal canal by piercing the transversus abdominis. Okay. Within the inguinal canal, in male, it is accompanied by spermatic cord. In female, there will be round ligament of uterus. The ilioinguinal nerve is a partial content of inguinal canal. It emerges out of the superficial inguinal ring. Please note, it is not present in the deep inguinal ring, but it is now present emerging out of the superficial inguinal ring. The ilioinguinal nerve, after emerging out of the superficial inguinal ring, it supplies the internal oblique muscle, the detached part, cremastric muscle. Therefore, it is involved in cremastric reflex. What is cremastric reflex? If you scratch the upper and medial side of the thigh, the cremastric muscle, there will be reflex contraction of that muscle. That shows the cremastric muscle and the skin of the upper and medial side of the thigh is supplied by this nerve. What is this nerve? Ilioinguinal nerve. So this ilioinguinal nerve ultimately supplies the skin of the anterior part of the scrotum and the medial side of thigh, also supplies the internal oblique and the detached part of internal oblique cremastric muscle. It is a partial content of inguinal canal. It is a ventral rami of L1 or the first lumbar nerve. To summarize, there are three nerves running parallelly on the posterior surface of the kidney from above downwards. The first one is subcostal nerve, the ventral rami of T12 nerve or the 12th thoracic nerve. The intermediate one will be iliohypogastric nerve, which supplies the muscles of the anterior abdominal wall and ends by supplying pyramidalis. It goes in the hypogastric region, therefore called like that, iliohypogastric nerve. And the last one is ilioinguinal nerve. This ilioinguinal nerve passes partially through the inguinal canal, emerges out of superficial inguinal ring, supplies the skin of the anterior part of the scrotum or the anterior part of labia majora in female, and also upper medial surface of the thighs, and supplies cremasteric muscle. It is involved in cremasteric reflex, the ilioinguinal nerve, ventral rami of L1. So this is in detail about these three nerves: the subcostal nerve, the iliohypogastric nerve, ilioinguinal nerve. In case of anesthesia of this region, in the genital region, we can inject and block the ilioinguinal nerve supplying the genital area. Okay, thank you for watching and learning from Logic Medico. Kindly subscribe to our channel. If you are new to our channel, kindly consider subscribing and share this video with your other friends too. Thank you once again.